Let's now go to your section 1 of your module with serial key WINTERFELL-1159. Number 1, the nurse provides information to a client about performing breast self-examination. So the topic is about breast self-exam. Nurse determines that the client needs additional information if the client makes which statement. So we're looking for a negative statement. Number 1, BSE must be done monthly. This is positive. That's true and correct. Number 2, lumps in my armpit are normal. This is negative. Remember that lumps are abnormal. Okay. Number 3, I can palpate my breasts with soapy water while showering. This is positive. BSE can be done, or actually appropriate breast self exam should be done after shower or while showering. Number 4, I should perform the examination on the day that I start my period. This is negative because your breast self exam must be done 2 to 3 days after your mens. 2 to 3 days after mens. Number 5, when I squeeze my nipple, I should expect to note some discharge. This is negative because like lumps, discharge from the nipple are also considered not normal. It needs further assessment. Number 6, I should stand before a mirror and inspect each breast for anything unusual. This is positive. And since we're looking for negative answers, here the answer would be your number 2, your number 4, and of course your number 5. So these are the negative statements that needs further clarification. Next, number 2. A client who sustained thoracic cord injury a year ago returns to the clinic for a follow-up visit, and the nurse notes a small reddened area on the coccyx. Client is not aware of the reddened area. So the client has a thoracic cord injury and is not aware of the reddened area. After counseling the client to relieve pressure on the area according to a turning schedule, which action by the nurse is appropriate? A. Teaching the client to feel the reddened area. Eliminate. Remember, your client has thoracic cord injury, so there's a chance that client cannot feel, or you cannot actually feel reddened area. You must inspect, not feel. Right? Next, letter B. Asking the family member to assess the skin. And letter D, scheduling the client to return. Eliminate them both because your letter B and D can be done by the client. So it's not, you don't need to endorse it to the family. Can be done by the client. So the best answer is letter C because letter C promotes independence. You're promoting the independence of your client. You're including your client to his or her care. So the answer is letter C. Next, number 3. A nurse is caring for a client who is receiving ECT for a major depressive disorder. Which assessment finding would the nurse identify as unexpected side effect of ECT that requires notifying the physician? Answer, letter C. Because in ECT, blood pressure changes is not expected. While your A, B, and D, these are actually expected side effect. These are expected side effect of your ECT. Letter C is the answer. Next, number 4. A nurse provides discharge instruction to a client with testicular cancer who had testicular surgery. The nurse tells the client, A. Avoid driving a car for at least 8 weeks. Eliminate. The client needs to avoid driving for only 1 week, not 8 weeks. B. Not to be fitted for a prosthesis for at least 6 months. Eliminate. Because prostheses are inserted during surgery. So during removal of your testis, the doctor will also put a prosthesis inside. So this is done already after surgery. Between C and D, the answer here is Dallas, because this is a sign of what? A sign of infection. Letter C, avoid sitting for long periods for at least 6 months is usually teach or taught on clients who had prostate surgery. If your client had a prostate surgery, then letter C applies. But for testicular cancer, it does not. The answer here is Dallas. Next, number 5. The home care nurse is assisting a client in managing cancer pain. To ensure the client that to ensure that the client has adequate and safe pain control, nurse plans to A. Rely totally on prescription and over-the-counter medication. Totally is an absolute words, eliminate A. B. Keep a baseline level of pain so that the client does not become sedated or addicted, eliminate, because addiction or being addicted is not our concern. Our priority here, remember, the priority here is pain. Okay, so eliminate B. Between C and D, the answer is Dallas. Because letter C, eliminate that because this is unsafe. Trying multiple medication is not safe for the client. So only one is safe and adequate, and that is Dallas. Next, number 6. Which assessment is most important for the nurse to make before advancing a client from liquid to solid food? So in this situation, the client has already a diet, which means the client is already eating. And the issue here is, what will you check before advancing a client from liquid to solid food? So eliminate A, bowel sound. The bowel sound is most important if your client is from NPO and you will advance your client from NPO into something new or something, whether it's liquid or diet. As long as it's from NPO and i-advance mo siya to a point na kailangan niya na kumain, bowel sound is the most important. Okay? Next, current appetite is not your priority and food preference is not your priority. In order for you to advance your client from liquid to solid, make sure that the client can chew the solid food first. And that is letter B. Next, number 7. The nurse is caring for an obese client on a weight loss program. Which method should the nurse use to most accurately assess program effectiveness? So we're trying to evaluate the effectiveness of weight loss program. And for you to be able to evaluate this accurately, you need to, letter A, weigh your clients. INO will refer to fluid status, while letter C and D is about nutritional status. Therefore, the answer is letter A. Next, number 8. Which of the following ABG should the nurse anticipate in a client with a nasogastric tube attached to a continuous suction? So, a client has NGT and continuous suction. This type of clients are prone to alkalosis because this client is losing hydrochloric acid. Therefore, let's eliminate A and B because these two talks about acidosis. Right? So it should only be between C and D. The answer here is Dallas. Why? Because in letter C, look at the level of CO2. The normal CO2 is 35 to 45. So this is a bit low. Remember, in the situation, there is no mentioned respiratory disorder. Therefore, expected CO2 will be within range or normal. Therefore, the answer here is Dallas. Next, the nurse requests that a client with diabetes mellitus ask his or her significant other to attend an educational conference about self-administration of insulin. Clients question why significant others need to be included. The nurse's best response will be A. Family members can take you to the doctor. No, you do not need uh, to educate your client about or should I say, you do not need the family member to educate in self-administration just to be able for them to take the client to the doctor. The client can take himself to the doctor. Letter B, members are at risk in developing diabetes. Yes, this may be true, but remember, if you're at risk, the focus of education should be on prevention and not on insulin injection. So between C and D, the answer is Dallas. Look at C. Nurse needs someone to call and check on a client's progress is not actually a priority while you need to educate this client. The answer here is Dallas. Clients and families often work together to develop strategies for the management of diabetes. Next, number 10. Nurses care for a client who is recovering from the sign and symptom of autonomic hyperreflection. Nurse makes which therapeutic statement to the client? Is it A? How could your home care nurse let this happen? Eliminate because this is judgmental and incriminating. Letter B. Now that this problem is taken care of, I'm sure you'll be fine. Eliminate B because this is a form of false reassurance. This is a form of false reassurance. C. I have some time if you would like to talk about what happened to you. D. I'm sure you now understand the importance of preventing this from occurring. So eliminate D. The answer is C because letter D is nurse-centered. You should focus on the client and not to yourself. The answer is letter C because in letter C, it promotes what? Verbalization of feelings. Therefore, the answer is letter C. Next, while assisting a client with spinal cord injury with activities of daily living, client states, I can't do this, I wish I were dead. Nurse makes which therapeutic response to the client? A. Why do you say that? Eliminate because never ask why. Remember, inside they tell you that never ask why because you're placing a client in a defensive situation. B. You wish you were dead? C. Let's wash your back now. Obviously wrong because this is very very far from the topic. This is very unrelated. D. I'm sure you are frustrated, but things will work out just fine. Again, these are forms of what? False reassurance. Therefore, the answer is Boston. This is a form of restating the statement of your client, which shows that you acknowledge the statement of the client. Next, the client with a spinal cord injury makes the following comments. Which comment warrants follow-up by the nurse? A. I'm so angry that this happened to me. B. I'm really looking forward to going home. Eliminate B. This is a, a form of a normal response. Now, in this situation, the question is trying to ask you in which statement does the nurse need to give a therapeutic statement. So obviously B is not because that is very very a normal adaptation to a disease. Okay, letter C, I know I will have to make major adjustment in my life. And letter D, I would like my family members to be here for my teaching session. These two are good response. They indicate what? Understanding. So the nurse does not need to give therapeutic statement. The answer here is letter A, because letter A is signs of anger. Therefore, the nurse need to give or provide therapeutic communication. Okay. Next, the nurse in ambulatory clinic administered tuberculin or mantle skin test to a client on a Monday. The nurse tells the client to return to the clinic to have the result read on A. Thursday, B. Following Monday, C. Tuesday, or D. Wednesday. So remember that your protein or your purified protein derivative, or also called your MAN2 test, is a test to check exposure to TB. Exposure to TB. Okay? It is usually read by the physician after the book says its reading will happen after 48 to 72 hours or after 2 to 3 days. Therefore, if it was injected on Monday, expected that the doctor will read that by Wednesday or Thursday. Monday, Tuesday, Wednesday, or Thursday. Yes, letter D is the answer. Next, client with chronic obstructive pulmonary disease is admitted to the hospital with exacerbation and has a nursing diagnosis of ineffective airway clearance. The nurse assessed the client and determined that which factor contributed most to this nursing diagnosis. Now remember, ineffective airway clearance is a type of diagnosis that we make if there are presence of secretion in the airway. And among these four, the only thing that can affect secretion is Boston, fluid intake. Because if you increase fluid tendency, you decrease secretion, because fluid will liquefy secretion. It will be easier for the client to remove this secretion if it's liquefied. So the answer here is letter B. Next, number 15. A nurse is caring for a postpartum client with thromboembolic disease. When planning care to prevent the complication of pulmonary embolism, the nurse plans to specifically to A. Enforce bed rest. Remember, this will further increase the risk. So eliminate A. B. Monitor the vital signs will not prevent pulmonary embolism. C. Assess breath sound, or D. Administer anticoagulant. Answer letter D, because anticoagulant prevents clot formation. And we all know that clot formation or this clot serve as the embolus, which causes pulmonary embolism. Answer lalas. Next, number 16. A perinatal client is admitted to the obstetric unit during an exacerbation of a heart condition. When planning for the nutritional requirements of the client, the nurse would consult with the dietitian to ensure which of the following: A low-calorie diet to prevent weight gain. Eliminate, because low-calorie is not advised for pregnant client. Okay, so doing A. Look at D. Unlimited sodium. This is dangerous. This can cause what? Increase blood pressure. So eliminate D. So between B and C, the answer here is Boston. Fluids and fiber to decrease constipation, because constipation stimulates your client to perform Valsalva, and we all know that Valsalva can cause bradycardia, and bradycardia may worsen the client's heart condition. So the answer is letter B. Next, a nurse obtains a fingerstick glucose reading of 425 mg per on a client who has recently started on parenteral nutrition. What nursing action is appropriate at this time? The answer here is Letter C. Notify the physician because the normal glucose in the body should be less than 200 milligram. So obviously, the client is experiencing hyperglycemia. And hyperglycemia is considered, okay, hyperglycemia is considered a complication of TPN. So the client is already developing complication, therefore there's only one thing you can do, and that is to notify the physician. Next, client who is at 45 weeks of gestation calls a nurse at the clinic and reports a sudden discharge of fluid from the vagina. Based on the data provided, nurse suspect which of the following condition? A. Miscarriage. Eliminate, obviously, because miscarriage is a condition where there is termination of pregnancy less than 20 weeks. And the client is already 35 weeks. Eliminate letter D. Eliminate letter C. Let me erase that. Eliminate letter C because there is no data to support this. So between B and D, the answer is Dallas. Premature rupture of membranes. Eliminate B because there is no contraction mentioned. No uterine contraction mentioned. Next. Number 19. A client who is suffering from urticaria or hives and pruritus says to the nurse, "What am I going to do? I'm getting married next week and I'll probably be covered in this rash and itching like crazy." Which of the following statement made by the nurse is the most therapeutic? A. You're troubled that this will extend into your wedding. B. It's probably just due to pre-wedding jitters. You'll be fine. Eliminate. These are form of false reassurance. C. The antihistamine will help a great deal. Just wait and see. Eliminate again. A form of false reassurance. So between A and D. Letter D. I hope your husband-to-be has a sense of humor and can laugh about this is of course not therapeutic. The answer is letter A. Next, number 20. While assessing a 14-year-old client, the nurse noted bruises and cigarette burns on the child's chest. So already the nurse determined that these are bruise and these are what? Cigarette burns. Therefore, there's already a form of abuse here. Child states, "I'm afraid to go home because my stepfather will be angry with me for telling on him." Nurse should respond by saying, is it A, you can't go back there with that man? How do you think your mother will react? It's not therapeutic. Remember that the child, you don't need to tell the child you can't go back because the child doesn't want to go back based on the statement. B, you must know that your presence in the hospital will only teach your stepfather more. Is obviously wrong because it's like saying you want your client to go back so that the stepfather will not get more mad. C or D, letter C, I'm sorry that this has happened to you, but you will be safe here until plans can be made. Or D, let's keep this between you and me and physician until we formulate further plans to assist you. Eliminate D because it is a responsibility of the nurse. Responsibility of the nurse to report all form of abuse. The answer here is letter C. Safety is your priority at this time. So that ends the first section of your module. Looking forward to the next section. Thank you and goodbye.